My name's Lynelle Hales. I'm the Chief Executive Officer of Sydney North Health Network, which is one of 31 PHN's primary health networks across Australia, which is funded by the Commonwealth Government. And basically we support all of the out-of-hospital side of it. So through education, training, enabling GPs, allied health, clinicians working together, but also in terms of like commissioning. So we hold budgets and work with the community and the stakeholders and look and develop local solutions for mental health, particularly allied health, and alcohol and other drugs, things like that. So I started as a nurse, and so I've really lived my life in the public sector, and I think along with most people that work in the public sector, because I want to make a difference. So that real element of seeing the work that you do and the solutions that you create and things that you can enable, improve service delivery for patients, but also for making sure that we've created the smoothest system that we can, gives me real satisfaction, and you know, it really drives my energy and flow across the to work together to create solutions. So probably in working in primary health networks, probably the biggest challenges we've done is in commissioning, and that's been working across the system. So while our budgets are about quite small, actually when you link it across, so in mental health, for example, we've developed a stepped care approach. So it's not just looking at one element of mental health, even though our budget might be small, by linking it with the acute and across the system and all the other health providers and community providers across the health and social systems, you can really make a difference. And so it's actually bringing all the players together, talking to consumers, actually working out what locally is the priorities and how would the solutions best work, and and creating the solutions together, and then commissioning that out and getting working with the providers to really keep that continuous improvement and engagement has been, really, I think, probably one of the major projects that has been successful, and we can start to now, after 2.5 years, see impact. So we're working towards outcomes and how we start to measure that, which is always a challenge in the primary health side of it. While data is starting to develop, that side will really build on our evidence base and enable ongoing solutions. But it started, and we can actually start to see impact, and we can start to see the services deliver, which has been really powerful. So for me, innovation, particularly in leadership, is around never just resting on your laurels. So it's that continual change, the continual improvement. There's an element where we might be experts and have an amazing background or experience developing something, but the world changes. Whether it's the politicians and the political environment we're living in, or actually the digital environment, as we can see over the last 20 years, has completely changed the way that we work. And how do we ensure that we stay on top is innovate. And so it's actually re-looking fresh eyes every year, and not assuming that just because we commissioned this or we did this last year, it's still relevant and it's still working, but actually then revising and adjusting and innovating and coming to events like this where you can learn and grow and expand and think, okay, here, all right, so how do we get there, and what's the next step, and how can we adjust what we do slightly so that we're moving in the right direction without completely alienating everyone around us, so that we can bring our community and our clinicians with us, but actually work towards a future work that they're ready for. And so it's that sort of adjustment, I think, which is really powerful in innovation. So finance is always a major challenge, and I'm sure everywhere in Australia you hear that, and particularly because we have a Commonwealth funding, but you also have state funding, and and there's also local government initiatives. So there is a complexity of healthcare in Australia is probably quite unique, and how do you create integration and a great solution together across a health system without incentivising the wrong things? So where the outcome that we want is not to cost shift between federal or state funding, is actually to work together and pool the funding and actually do something really different. And that's the powerful system that makes integration quite unique in terms of it gives you the ability to talk and go, actually, what are the elephants in the room? How do we create a solution together that's for the right reasons without penalising anyone, so that there is a win-win across the system, but actually the funding is spent in the best way and the incentives built into the system are incentivising the right thing. Really difficult. So that's probably the biggest challenge in integration. Probably the other big challenge is change. Everyone's really busy. Like for general practice, for example, they are flat out from the start of the day to the end of the day seeing patients, and then we come along and say we've got these great digitalised solutions, and if you proactively manage your patient population, you can start to prevent hospital admissions and things like that. And they're going, when am I going to fit that in? And that's great that I can do this extra care planning, but that's going to take me this extra time. How do I then incorporate that in an already busy and not necessarily well financed part of our health system? So there's an element of how do we create solutions that fit into a busy environment that enables our busy providers, who are our key, they are our critical element of success to actually build the future that we're talking about. And I think the only way we can do that is creating solutions that work, that aren't going to cost extra time. Example is we commissioned a mental health service. We had a great referral system that had this all data collection and everything. It was 8 pages long. So the GP, and we couldn't understand why nobody was using it. So they're all going to a different system. They were bypassing the system because we'd made it a barrier. And so we created that and went, oh, okay, that wasn't exactly what we wanted. And so I think that's the key part, is actually that change management, that support to making sure that we are creating solutions that work not just for the outcome in terms of consumer, but also for the health system and the environment and our clinicians that are our key assets to enabling the improvements. So I think they're probably the biggest challenges that we come across, is that we know where we want to go and we can sometimes have the technology to do it, but we have to create the solutions along the way to bring our clinicians and our consumers and everyone with us. And I think that's probably our big challenges of integration. Yes, so I think even regardless of trend, that's absolutely how we have to work. And I think nobody, which is great when you consider like one element, so whether it's mental health or primary or acute care type thing, you sort of think, okay, this is the components, but nobody has one disease. Nobody has, and the reason that somebody might have stopped their medications when they're on diabetes and eaten cake and done all the wrong things is not necessarily because of their diabetes. It's their health and their well-being and their social and their and all of and they're socially isolated, and there's all of those complexities that make up an individual. And I think the wonderful part of how we are viewing things now is that whole health and well-being and the social side of it is being recognised, and so the only way that we can really start to work together to enable that is to work across health, aged care, social services, mental health, and take all of that into account as we develop services, and almost become the navigators, so that we can navigate across the system to say, actually for you it's going to be about finding accommodation, or it's going to be about linking you into social services or support, or community, linking you back into the community so that you can build on and be well regardless of what you're presenting with. And I think that's the future. So it's now, how do we, as our siloed professions, whether it's the acute or primary care or aged care, how do we start to link across the system to make that possible? And I think digital health is probably a fantastic tool to do that. And have we got it right? Not yet. But everyone is coming to the table, and I think that's really the first step, and to creating the solutions and to creating what's possible to move forwards and integrate across. And some of the technologies now that map the journey is exactly where we need to be at, so that we can support the journey through the system. And work out how we can get the funding to follow the patient rather than the funding being in all the different silos. So that's the future. We're here. So we've got a little way to go, but I think actually it's great that we're moving in the right direction. This has been fantastic presenters. Probably my favourite this morning was the consumer, and he really well articulated sort of like hello, and often that we miss the point when we develop these great solutions, but it's not necessarily about what the patient wants, and often we get it wrong because we are coming from a top down, where this is your condition and this is how we can smooth the system, not necessarily about is that actually what they want, and have we really enabled it coming from their point of view. And I think that's really, it was quite a powerful message that I think we can really take back and go, have we really asked, and have we really adapted the service to make sure that when we implement it, that it works and that it's actually useful and it makes a difference.